name's Susan Gladwish. I started working at the Canberra Hospital in August of 1973. It was the Woden Valley Hospital way back then. I was a 17-year-old student nurse.
Hi, I'm Kathy Broderick and I'm a registered nurse, and I've worked in ACT Health since 1974.
Well, my first day in ACT Health was when it was probably not even called ACT Health. It was the Australian Capital Territory Health Commission, I think, at the time. It was in 1987.
Hello, my name's Paul Fowler. I moved to Canberra in August of 1990. Started work in the maintenance department at Woden Valley Hospital.
Prior to starting, we had an interview with Mary Gillespie, she was then, and we had to bring our parents along with us. So my mother came to the interview with me, and I think she had more of the interview than what I did at the time. There were only 3 wards open from memory in those early days: a very basic medical ward, surgical ward and a geriatric ward.
You can imagine your first day on a new job, you are fairly anxious. You're meeting lots of new people for the first time. You're seeing new places that you haven't really seen before, just where you are working, the laboratory you're working in, and the people you're working with. And to compound the problem here is the hospital used to be over 2 sites. When I was first here, we had Royal Canberra Hospital and we had Woden Valley.
Prior to commencing work with ACT Health, I moved up from Wodonga, where I had been the maintenance manager with Lee Jeans and Sunny Crust Bakeries.
Canberra back in the early 1970s was really just like a big country town. I think not a lot has changed, except we have grown into a city, and a beautiful city it is.
Living in Canberra and around the Woden area in 1974 was extremely different to what it is now. It was very quiet, very countrified.
Canberra really hasn't changed much over the years. It's still a city in the country. Everybody seems to know everyone, no matter where you go.
In 1977, I went on to do my midwifery training at the Woden Valley Hospital as well. I've been basically working in maternity ever since, which is what I think I do best. Love maternity nursing and midwifery. Basically, a lot of things haven't changed, except maybe our diagnostic ways of doing things, ultrasounds. We now do a lot more ultrasounds. We can diagnose things a lot earlier with the babies. And
ACT Health has been a very good place to work because there are so many different areas that you can work as a nurse in the community, in the hospital. There's different hospitals, different aspects of nursing. I have probably covered most aspects around child health, adult health, working in the theatre. I feel like I've gained a lot of experience, and it's been a very interesting type of work. I've enjoyed it immensely, and I've learnt a lot and made some friends for life.
The way the Canberra Hospital's grown over the years, it's like a community all to itself. We have a range of healthcare facilities, private shops, roads, you name it. It's grown massively over the years.
I feel I've made a difference to ACT Health in the way I've contributed towards preceptoring new staff and mentoring the younger staff in my area. I've also, over the years, provided a lot of support and advice and education to new parents, and hopefully given them the confidence to parent their children in a more enjoyable way.
From my own perspective, one of the biggest advantages of being in Canberra is that we've managed to put it on the map as a national centre in infection control and infectious diseases. We've established many processes here where we measure things, look at how things are done and improve them here that have become part of national innovations or processes that have been put in place. And I think I'm very proud that I've been one of the people involved and one of the leaders locally, both in infection control and infectious diseases, obviously with a whole lot of other people, other doctors and nurses, but it's established a benchmark that's been used Australia-wide. And by being in Canberra and being able to do those things, I've been personally able to do things internationally with the World Health Organization in issues like antibiotic resistance.
Providing a maintenance service for the departments in the hospital has been a great challenge over the years. I like to think that I've managed to provide a service that has been quick and efficient so that any downtime was kept to a minimum. And keeping maintenance services at the hospital efficient and on time could not have been possible without a dedicated maintenance crew of 5 different trades who are willing to put in the big yards when necessary.